Welcome to Omni Dental Podcast. Today we're diving into a really fundamental question for anyone thinking about replacing missing teeth. It's this. Can you get dental implants if you have gum disease?
Yeah, that's a big one we hear all the time.
Right, because gum disease is just so incredibly common. It's a major reason people lose teeth.
Absolutely. A leading cause.
So naturally, if you're looking at implants to, get your smile back, the health of your gums, your jawbone, that's going to be top of mind.
It has to be. Implants need that solid foundation.
Exactly. So in this deep dive, we're going to explore just how gum disease and implants interact. We'll look at the different stages of gum disease, what they mean for your options, what treatments are needed.
And crucially, how to set yourself up for long-term success with implants, even if you've dealt with gum issues before.
Okay, perfect. So it's not just a straight yes or no then.
Definitely not. It's nuanced. Understanding that link between gum health and implant success is really key. Maybe we should start with the basics. Like, what exactly is gum disease?
Good idea. Let's unpack that.
Yeah.
So gum disease, or periodontal disease, as dentists call it, it's essentially a bacterial infection, right? It attacks your gums.
That's it.
It can start out pretty mild, maybe just some inflammation you barely notice.
Or maybe some bleeding when you brush.
Yeah, exactly. But if it's left alone, it can get much worse. It can seriously damage the gums and the bone underneath that holds your teeth in place.
And like you said, it's a huge problem globally. Big reason for tooth loss.
Okay, so that's gum disease. Now, implants. Remind us what those are.
Sure. Dental implants are basically small titanium posts. We place them surgically right into the jawbone where a tooth is missing. They act like artificial tooth roots. Super stable.
Giving you that strong base for a replacement tooth or bridge?
Precisely. But for them to work, for that titanium to fuse with the bone, a process called osseointegration, they absolutely need healthy surroundings.
Healthy gums and enough good quality bone.
That's the foundation we're talking about.
So how does active gum disease mess things up for implants? What's the direct impact?
Well, probably the biggest issue is bone loss.
Okay.
Think of your jawbone like, well, the foundation of a house. Gum disease acts like erosion. It just eats away at that bone over time.
Weakening the support.
Exactly. If you lose too much bone, there might not be enough left to securely anchor an implant.
So you might need extra steps.
Right. You might need a bone graft first, which is a procedure to rebuild that lost bone. It adds time and complexity, you know.
Makes sense. Bone loss is critical. What else?
Receding gums, that's another big one.
How does that affect things?
Well, as the gums pull away from the teeth because of the disease, they expose more of the root surface. And they create these little gaps or pockets between the teeth and gums.
Places for bacteria to hide.
Exactly. Perfect breeding grounds for harmful bacteria. And that dramatically increases the risk of infection developing around an implant if one is placed there.
Infection around an implant? That sounds bad. Like, really bad.
It is. It can lead to implant failure. And beyond that, just the presence of active gum disease means there's inflammation in your mouth.
Chronic inflammation.
Yes. And that inflammation itself can actually interfere with that critical osseointegration process we mentioned.
The fusing of implant to bone.
Right. It's like trying to weld something that's constantly being jiggled or is contaminated. The connection just won't be as strong or reliable.
That's a great way to put it. So it really sounds like the stage of gum disease someone has is super important when thinking about implants.
Absolutely critical. The severity dictates whether implants are even an option right now and what needs to happen first.
Okay, let's walk through those stages then. What's the early stage?
The earliest stage is called gingivitis. This is where you might see some redness, maybe swelling. Gums might bleed a bit when you brush or floss.
But the bone isn't usually affected yet.
Typically not in a significant, irreversible way. And that's the good news. With prompt treatment, good professional cleaning, improving your home care gingivitis can often be reversed.
So if you catch it at the gingivitis stage and treat it, implants might still be on the table later.
Yes, very possibly. You need to get the gums healthy first, but it doesn't automatically rule out implants down the line.
Okay. What happens if it progresses beyond gingivitis?
Then you move into periodontitis. Now the infection has gone deeper. It's actually started to destroy the bone that supports your teeth.
So you'd see more gum recession, maybe teeth feeling a bit loose.
Exactly. Those are common signs. At this stage, getting implants often requires more intervention first.
Like the bone grafting you mentioned.
Very commonly, yes. If you've lost bone, we often need to rebuild it with a graft before an implant can be safely and successfully placed.
And what about the most severe stage?
That's advanced periodontitis. Here, you've got significant bone loss, often quite a bit of gum recession, maybe pus, and usually active ongoing infection.
Sounds pretty serious.
It is, and trying to place an implant into that kind of environment is really risky. Generally, it's a no-go until the gum disease is thoroughly treated and under control.
Okay, that's clear. So, for someone listening who has gum disease, maybe they know they have it or suspect it, and they want implants, what are the absolute key steps?
Step 1, non-negotiable. Treat the gum disease first.
Get rid of the active infection and inflammation.
Absolutely. You cannot build a strong house on shaky, infected ground. It just won't work long term.
So what does that treatment usually involve?
It typically starts with thorough professional cleanings, sometimes called deep cleaning or scaling and root planing. This removes all the plaque and tartar buildup from above and, crucially, below the gum line. We might also use antibiotic therapy, maybe locally applied or sometimes pills, to really knock down the bacterial load.
And home care becomes even more important.
Critically important. Stepping up your brushing and flossing game, maybe using special mouth rinses. That commitment from the patient is huge.
And skipping this step, just going for the implant. Big mistake.
Huge mistake. It significantly increases the risk of the implant failing, and it can actually make the gum disease itself worse. You could lose more teeth.
Okay, step 1, treat the disease. What's next, assuming that's successful?
Once the active infection is controlled, we assess the damage. We look at the bone levels and the health of the gum tissue itself.
Addressing the consequences of the disease.
Exactly. If there's been significant bone loss, now is when we'd likely do that bone graft to rebuild the site. And we also need to make sure the gum tissue is healthy, stable, and has enough thickness and height to properly support and seal around the implant. Sometimes gum grafting is needed too.
Restoring the whole foundation, bone and gums.
That's the goal. Create a healthy environment for the implant.
And then, after the implant is placed and healed, what about maintenance? Is it different if you've had gum disease?
Maintenance is always crucial for implants, but it's arguably even more critical for someone with a history of gum disease. They might be inherently more susceptible.
So no slacking on hygiene.
Absolutely not. This means meticulous brushing, at least twice a day. Daily flossing is key. Or using other tools like interdental brushes or water flossers to clean around the implant. And sticking to your regular dental checkups and professional cleanings is paramount. Your hygienist can clean areas you might miss.
What happens if you don't keep up with it?
You risk developing something called periodontitis.
Which is like gum disease, but around the implant.
Exactly. It's inflammation and infection affecting the gums and bone supporting the implant. And sadly, it can lead to the implant becoming loose and eventually failing.
So the commitment doesn't end when the implant goes in.
Not at all. It's a lifelong commitment to excellent oral hygiene. Oh, and an interesting side note, keeping saliva flowing is helpful too.
How so?
Saliva helps neutralize acids and wash away food particles and bacteria. Chewing sugar-free gum, for instance, can stimulate saliva flow. A small thing, but it helps.
Good tip. So really, this meticulous hygiene isn't just about the implant, is it?
No, it's about your entire mouth. It prevents plaque buildup around the implant and your natural teeth. It reduces the risk of bad breath, often linked to gum infections. It helps keep all your gums healthy, minimizing further recession or looseness. It's about protecting your overall oral health and ensuring both your implants and any remaining natural teeth last as long as possible.
Okay, let's pull it all together. For someone listening with a history of gum disease, can they realistically get successful dental implants?
Yes, a definite yes, but with some really important conditions.
The big if.
The big if. Success is absolutely achievable if the gum disease is treated properly and thoroughly before implant placement. And if you commit fully to maintaining excellent oral hygiene and regular dental care afterwards.
And the flip side, ignoring the gum disease?
That's courting disaster, frankly. Proceeding with implants while gum disease is active dramatically increases the chances of complications, implant failure, and potentially even more tooth loss down the road. Don't do it.
So, the bottom line for anyone in this situation considering implants.
Talk to your dentist. Get a proper evaluation.
That's the crucial first step.
Absolutely. You need a thorough dental exam to see exactly what's going on with your gums, what stage any disease is at, how much bone you have. Only then can you get a personalized plan. Your dental professional can assess if you're a candidate now or what needs to happen first and outline the whole process for you.
And for those of you listening in the Arlington Heights area, or maybe nearby in Buffalo Grove, Palatine, Mount Prospect, if you're concerned about gum health or thinking about implants, Omni Dental is right here. They offer a really comprehensive range of services. They handle everything from diagnosing and treating gum disease, including things like deep cleanings, and even advanced gum disease laser therapy.
Which can be very effective for certain cases.
Right. And they also provide the full spectrum of dental implant solutions. Whether you need a single tooth replaced or maybe a full arch restoration, they do it all, including bone grafting if that's needed.
Having everything under one roof, managing the gum health and the implant restoration can be a real advantage.
Definitely. The dentists there, Dr. Billis Poles, and the whole team really focus on personalized treatment plans. They use advanced technology and really prioritize making sure you're comfortable and getting results that last for the long term.
That focus on long-term health is key, especially with this connection between gums and implants.
So just to recap the main point, if you've had gum disease, implants are still possible.
Yes, encouragingly, yes. But treatment first, hygiene always. Those are the non-negotiables for success.
Treat the cause, maintain the health.
You got it. Establish that healthy foundation and then be diligent about keeping it that way.
So if you think you might have gum issues or you're just exploring implant options, please schedule that dental exam. Get the facts about your specific situation. It's the best way to figure out the right path for your smile. And again, if you're local to Arlington Heights, Omni Dental's number is 847-483-8833. You can also find them online to schedule an appointment.
Thinking about how closely gum health is tied to the success of something as advanced as dental implants, it really just highlights how vital that basic, consistent oral care is. Brushing, flossing, seeing your dentist regularly, it's the foundation for everything, including these amazing modern solutions. It's all connected for a lifetime of healthy smiles.